Hagen. Welcome.
Thank you, and I just want to say hello to everyone. We're right down the street at 69 Main Street. I don't know whether everyone is familiar with Lawrence. It used to be the Home Nursing Association of Tuckahoe.
Yes.
Was then merged into Lawrence Community Health Services, in which we have home care, hospice, and bereavement. I'm with Murray Shom, who is our Rehab Supervisor. He's going to follow up after my little thing of the home care on falls prevention and tips for safety. Okay, so I just wanted to really explain. It's very confusing, home care services, and it's difficult to understand. So I'm trying to clear that up for you so that you have a better idea of what home care is. Home care is a broad term for all care that is provided in the home setting rather than in a hospital or a nursing home. And it is not just, we're called a CHA, a C-H-H-A, which is a Certified Home Health Agency. And that's the top level of home care services that someone could qualify for. Home care also includes the home health aide, the companion, the personal care aide, the homemaker, the housekeeper, and home attendant. That is not part of the CHA services. Home care includes both skilled and unskilled services. Skilled care or skilled services are required in order to qualify for the unskilled part of services under Medicare. Our primary funding source is Medicare for home care. Also the Medicare replacement policies, such as Aetna, HIP, they're all Medicare replacement policies. So they would be covered, home care would be covered under that policy. Home care will reimburse for a maximum of 4 hours, 5 to 7 days a week, if improvement is expected for an aide. The skilled services that Medicare covers are the skilled services of a registered nurse, a physical therapist, a speech therapist, an occupational therapist, and a medical social worker. Skilled nursing. Skilled nursing services are any treatment, teaching, or skilled observation and assessment. Physical therapy includes exercises, teaching about the exercises, and any treatments such as ultrasound and massage. Speech therapy is speech and language therapy, swallowing, feeding, and any cognitive training. I'm so sorry. This is, I'm sorry. This is Occupational therapist does activities of daily living, exercises, and any other treatment modality for the upper extremity. Social workers basically help the client to explore their community resources, assist them in long-term planning, and do some short-term counseling. The unskilled services that Medicare would pay for is the home health aide. That is the only part of the services that Medicare would pay for. They do not pay for the companion, the private caregiver or private aide, a housekeeper, or a home attendant. Other community services included in the title Home Care include Meals on Wheels, electronic medication reminders, Lifeline, telehealth monitors, friendly visitors, adult daycare, and long-term home health care programs. The criteria for home care services to be paid for under Medicare, you need to have a recent change in your medical condition. You need to have the skilled services of a licensed either nurse, therapist, or occupational therapist. You need to be homebound. Patients are only able to leave their home with the assistance of somebody or for a very brief period of time. And then the most important is that the physician must authorize the evaluation and collaborate with the clinician about the plan of care or the plan of treatment. And your home environment must be, that you must be able to be safely maintained in your home environment. For services to be covered by Medicare, they need to be the skilled services provided by either the nurse, the physical therapist, speech therapy, or occupational therapy. I just made a little example of what someone that would need to be on home care would be. So it's, as the example, it's a Miss Mary who's 86, fell at home and broke her hip. She had her hip repaired and she went into the hospital, and she then went to short-term rehab for 3 weeks. Miss Mary was then discharged home with an order for home care services. The home care nurse came to evaluate Miss Mary the following day. And based on Miss Mary's condition, including her ambulation status and her ability to perform ADLs, the nurse spoke with the physician to develop the plan of treatment. And the plan of treatment was skilled nursing twice a week to assess and evaluate Miss Mary's incision and wound care, medication compliance, understanding of her medication use, dose, effect, and side effects, as well as Miss Mary's risks for falls. The physical therapist was assigned to assess and evaluate her ambulation and home safety assessment. The physical therapist then was to develop a plan of care with the physician related to her ongoing physical therapy needs. The home health aide was put in, who was a bath aide, to visit her 3 times a week to assist Miss Mary with a shower. The social worker was put in to assist Miss Mary with her long-term planning of how she was going to manage when home care services ended. The home care service duration was from 4 to 6 weeks, and in 6 weeks Miss Mary's incision was very well healed. She knew how to take her medications, and the physical therapist was working with her for twice a week for 6 weeks to assist her with progressive ambulation, from learning to walk with a walker to walking with a cane, until she was able to ambulate to a car in order to be transported to an outpatient physical therapy. And now we have questions. Okay, thank you. Does anybody have any questions about what this is about what a certified agency was? Many times patients from the hospital are qualified for the certified agency. Many times clients leaving the hospital will just hire an aide, someone to help them as a companion. because they do not need the services of a certified home health aide. But home care is a global term, and it has many levels of care. So I just wanted to bring up what some of the levels of care were and what Lawrence Home Care can offer. I know that we have seen many patients in this building, and hopefully we will continue to. Yes.
We had a question today about Lifeline. Do you recommend, refer people to certain companies for Lifeline?
Yes, we do. Yes, and I actually have a handout that you can look at.
Okay.
Which, if it comes to us, I think there's also a discount on it.
Can you speak louder so they can hear?
I think there's a discount on it if
Yes.
it's ordered through us.
And you have bereavement counseling as well?
Yes, we do.
Okay.
Right now, my mother-in-law is underneath your care. I think she just started this week. How long does the care last that Medicare will pay for? Do you know? Because she's thinking it's just 2 weeks.
Well, it depends on what the nurse assessed was her needs. Sometimes it's, a couple of weeks for nursing. Sometimes it's longer for if the doctor makes a lot of changes in her medication, or if she has a wound that takes a longer time to heal. It can be upward to, 6 months, depending on what her needs are. Everything is based on an individual plan of treatment. Many times patients that have had an orthopedic situation where they need to walk or learn to walk with an assistive device and are progressing, the therapy can go on for, longer than 4 to 6 weeks. It depends on how the patient was at the beginning and how they're progressing. As long as there's progress, Medicare will pay for the service. If there's a lack of progress, Medicare does not pay for the service. Okay, it becomes what they call custodial. Once you reach a plateau or a custodial level, you can, an aide can do something for you. Someone can be taught what the exercises are. But there's no need for the skilled therapist to come in.
But right now, she's getting physical therapy and a home health aide to help her shower and bathe.
Right, right.
So I was just wondering, because my husband said she needs to call her regular doctor now, and she's saying, oh no, not until I don't have to see with my doctor until after I finish with these people here. And I'm like, that doesn't sound right either.
No, she needs to also follow up with her doctor because there's some issues that the doctor needs to address with her as far as her medical condition. Did anyone else have a question? I'm sorry for my back.
Yeah. What is the bereavement?
Bereavement,
Repeat the
there's,
question so they
oh,
can hear it.
this lady asked what day is bereavement? Bereavement is, you would just have to call, and then they would make an appointment for you to come in, and then they would see you and then evaluate what your schedule is and what your need is. Bereavement is on an individual basis.
Yes.
Yeah. Okay, I'd like to turn it over to Murray, who is our Rehab Supervisor. And what I can do is I can start passing out those forms, and we'll just see if we can. Let me see if we can get the other thing up.
Careful.
Hi, I don't know if
Can you hear?
I don't know if anybody here has been one of my patients, but I know I've had a number of patients over the years in this building as well. Yeah, let me move back. My name is Murray. I'm a physical therapist, and in case you're wondering, I'm also a rabbi. And I'm the Rehab Supervisor at Lawrence Home Care down the street, on Main Street. Been working with Lawrence now for about 8 years or so. And what I'd like to do today with you is to talk about an area that's very important, especially as we all get older. My 60th is my next birthday, so I'm feeling it too. That the yeah, right, I know. That's what my mom would say too. My mom's always 94. I'd like to talk about falls prevention, about how to prevent falling. Yeah, falling is one of the major reasons why an older person ends up in the hospital with something broken, an ankle or a hip or a shoulder, and it's very. How many of you have fallen? Yeah, so it's you're lucky if you survive the fall, and it's an important topic to deal with, and even if a lot of these things most of us know, it's good to hear again. Every once in a while, it's good to hear them again and go through the checklists and so on. Barbara's going to hand out really a checklist that you can go through when you get to your apartment and go through each thing and say, am I doing this right? Do I have scatter rugs, throw rugs that are loose and move on the floor, for example? There are a whole bunch of things that you can look at in your apartment and assess and see if, is it the way it should be? The goal is to minimize the risk. Can anybody tell me what you think the greatest risk for falling in the elderly is? The greatest risk. What do you think that might be? Yeah.
There's small carpets and carpets.
Small carpets in your apartment.
The bathtub.
The bathtub, okay. Anybody else?
Stairs.
Stairs is another one. Okay, these are all excellent answers, but I'll tell you an interesting thing. The greatest risk for falling in the elderly is the fear of falling. And when that's the highest? When you've fallen already. If you've fallen in the past and got hurt, that fear stays with you, unfortunately. And when you're in a situation where it is, the footing might be risky or whatever, it's slippery or something, the fear of falling that's inside of you becomes the risk to fall again. Because you freeze, you don't do the right thing because of the way you are feeling inside. That's something that we all deal with. I know 4 years ago I was up a mountain in New Hampshire and I fell and I was knocked out and I had a serious injury and I needed shoulder surgery following it. For several years following that, when it was a little icy outside, I had this feeling inside of me like, my stomach went up and down. Whenever I had a slight slip, it's that feeling that you have, that predisposes you for falling again. Okay? So that's not so much in our control. But there are many, many factors that are in our control, and that's what I'd like to address today. By the way, after the age of 65, the odds of falling each year is about 1 in 3. That's very high. 33%, of us will fall in the next year. That's really high. So we need to do whatever we can that's in our control to minimize that. So let me go through a number of 6 broad areas that I think will be helpful to look at. Again, on the checklist will outline in detail, a whole slew of things that will be helpful to look at. I'm going to look at some of them in detail and some of them a little bit more broadly. We have all kinds of slides here, but I'll talk and then we can probably go through the slides as a review. Number one is that you need to make an appointment with your doctor and to review the issue with your doctor. Doctors usually don't talk about this, all right? But it's a very important problem. You don't want to end up falling and then having to speak to the doctor. You want to speak to the doctor in advance and to review with the doctor what might be your risks and how the doctor can help you minimize the risk, okay? For example, what medications do you take? Okay, we're probably all taking something. So there are some medications that really predispose you for falling more than others. So for example, a medication like a blood pressure medication, okay, that if it lowers your pressure too much and you feel a little woozy when you, from going from a lying down to a sitting or to a standing position, or going from sitting to standing, if you feel like it, when you stand up, your head is a little dizzy, lightheaded slightly, okay, maybe you need an adjustment in your medication. So stuff like that, you know, you can speak to the doctor about it. The doctor doesn't know unless you tell him, right? Also, there are medications that can predispose us to falling, not just blood pressure medications, but other things that are known to have side effects to make you dizzy. For example, you know, many people are on painkillers for, you know, especially if you've had an operation or if you've had some type of an injury, a medication like Percocet. You know, I'm sure some of you have heard of it, you've been on it. That can make you dizzy, right? It has nothing to do with your blood pressure, but you'll get up and you get a whoa, you know, like that, the room is spinning. So you have to be very careful. If ever you experience those things, immediately you sit down or you lie down, you wait till it passes, you don't attempt again to get up or to walk unless you feel safe. Call somebody if it's not passing, right? Another thing that you can assess is if you have fallen before, try to think for yourself, like, why did I fall? Did I lose my balance? Did I trip over something? Was the surface, you know, did I just mop the floor? You know, and the surface was wet. Why did you fall? Were you dizzy? You know, what was the issue? That's something important for you to know. That's something that if you can identify why you did fall, that's something to review again with the doctor. You know, some of it is again in your control, some of it the doctor may be able to help you. Also, things like if you have, and a lot of us do have joint pain, for example, it hurts, your hip hurts, your back hurts, you know, whatever, your neck hurts. So pain, when you have pain, there's a message that goes from the area, let's say if you have a really bad arthritic hip, for example, pain messages go to your brain, and your brain sends a message to the muscles in your leg that says, shut down, I don't want to walk, I don't want to move, don't bother me now, because it hurts too much. So what happens is the muscles in the leg become inhibited, so they're not working properly. So you get up to take a step, that feeling of pain all of a sudden shuts off the muscles in your leg, and boom, you go down. Okay? Or it happens often with the knees. If you have pain in your knees, you can buckle, right? You've ever experienced that? So those types of things you need to be aware of. Also, numbness, right? How many of us have numbness on our feet, right, in our legs? So that as well, when you don't feel 100%, you know, through your feet, your balance is off. Okay? So that's another thing. If you can be aware of, what does that mean? No. If you can be, if you can be aware of the fact that you have numbness in your feet, it will again help for you to be more aware of the issues, the problems. Okay? Item number 2 is in this is sort of a 6-step item. Item 1 was make an appointment, speak to your doctor, assess yourself with the doctor's help. Number 2, you got to keep moving. Okay? It's easy as you get older to get lazier, right? To sit more, things hurt more, you know, you have less energy, etc., etc. I will make a proposal to you, and that is this. I firmly believe, and I've seen it again and again, if you feel like you have less energy, so what people normally say is, oh, I feel really tired, I feel fatigued. So what don't you do? You don't exercise. You don't push yourself to walk more because you feel really tired. Well, that is a spiral downward. What you need to do is, despite the fact that you feel tired, if your doctor says it's okay, you need to exercise. You need to increase your walking, you need to increase your strength, because over a number, I guarantee you, if you put in a week's worth of exercise daily, you will feel less tired after a week. You will start to feel your muscles are strong. You know what it's like? If I gave you a 30-pound backpack to wear all day long, right? So you would get really tired from that, right? Because your body is not used to carrying that weight around. But if I gave that 30-pound backpack to a guy who's a bodybuilder, he's an Olympic lifter, right? So for him, 30 pounds is nothing. He lifts 300 easily, right? So if I give him that 30 pounds, he won't even feel it. He's walking around with it all day. It doesn't matter. He doesn't get tired from it. What's the difference between you and this guy? Muscles. If your muscles are stronger, they're able to carry your body much easier, much more efficiently. You're less out of breath. You're much less tired. Right? Make sense? So walking, exercise will go a long way to help ensure better health in general, and in particular to help you from help prevent falls. If I know that in this building, I was told anyway, that, and I hope you go to it, they have exercise programs.
That's us.
That's you.
That's
Okay.
us.
I'm preaching to the choir here, right? So that's important. I mean, you should be, you should pat yourself on the back for doing it. But that's a key. If you're able to do any type of exercise programs, and you can do sitting ones even. There are sitting ones, standing ones. There are programs for older people that can be all in a chair even. But if you can do things like, and I think they have it here too, and maybe that's you also, Tai Chi,
That's
right?
us.
Okay, yoga, all that stuff.
Not yoga.
Not yoga, but Tai Chi is great for balance. I studied martial arts for 30 years. So, and I know all that type of stuff, and it's really great for your balance. Very helpful.
Black belt.
For,
And do you have a black belt?
I have several actually, different styles. So, don't mess with me. Okay. I did it until I was about 48 years old. And then I stopped. I haven't done it in about 12 years.
Pushing 50, he couldn't do it
So
anymore.
I probably got too much pain.
I just want to say something.
Yes.
We have here this, we have a very fast exercise class, and we also have Tai Chi.
Yeah.
Now, the other day, I and this other woman fell.
Oh, in the class? Where?
This Tuesday.
Right, you fell in the class or?
No, outside
Outside.
in the street,
Yeah.
we both fell. She was carrying something heavy, and she was supposed to be holding up to I was supposed to be helping her, holding her in my arm, to walk to my car. And what happened is we both fell down. I fell on my knees, she fell on her back. So what happened was, she only hurt her back, but I hurt my knee also. And two very young fellows both helped us right away. As soon as they got out of their car, they came and helped both of us. Got us up very fast. But we both were fine.
Good.
It turned out good. But I give credit to our exercise class, for myself especially, because
You're not getting injured.
Yes.
Yeah.
It's an injury. I felt it, but at least I felt
Right.
I recovered.
Good, thank
It
God.
wasn't serious.
Right, right.
And we had, she's going to take all the information, and I tell you, one of the things that we had some people come and help us right away. So we both were very fortunate.
Right. Yeah, you are
I
fortunate.
would say I recommend it
But
highly.
you know something, it's an interesting point that you're making, that
And we did
the
say so.
stronger you are, and
Right.
so, listen, falls are gonna happen, the accidents happen.
Right.
But if you're in better shape when you fall,
Well, that's
you're
what I-
less, right, exactly, and you're less likely to be injured. That's a very good point.
When I'm home, if I can't get out to the exercise that we didn't have for the whole summer,
Right.
at least I
Do
do
it
it right
in-
in front of my doorway,
Right.
and
Walk up and down the
run a little
halls
bit,
here.
That's all.
If you can't get out, if the weather's
I recommend it to everybody.
good. Thank you for that.
Amen.
Number 3, look at your shoes.
Right.
Listen, no more high heels.
Right.
They're terrible for many reasons, but they're certainly, as you get older, they're terrible for balance, it throws you off, they're unsteady, But look at your shoes. Are you wearing slip-ons? You shouldn't be, right? You should,
That's,
right, these type of shoes or, these are all good. You shouldn't be slip-ons. They should either be ties or Velcros that really secure it tightly. They should be a little wider. Sneakers are great, like New Balance types. I wear them all the time. They're comfortable and they're non-skid bottoms, right? Not like a leather bottom. Leather soles are slippery, especially if it's wet. But like a rubber bottom is the
I
best.
just want to ask you, now, they have this shoe that had the back open. Now, I personally don't think it's very
It's not. It's not. If you're 20 years old, that's fine. But if you're over 60, I would not recommend it.
That's what I say. I feel the
Right.
same way about it.
No, it's not. They're not safe. They're not safe. Okay. Not only that, I'll tell you an interesting thing. As you age, your foot changes too. It changes shape and it changes in size. Right, toes and the whole foot changes in size. Sometimes it's more swollen and you need actually a wider shoe. Sometimes you need a narrower shoe. So periodically, probably once a year, you should get your foot measured. So don't just assume like you've always been, 9.5 medium or whatever, that you're still that way. Always get it measured because if your shoe is not fitting properly, then you're more liable to fall. Okay. Okay. Step 4 is to remove hazards. That checklist you have there is great. To go through it, look around your apartment. Clutter should not be there.
Pets.
Boxes, newspapers, pets, right, dogs and cats. A lot of people fall having, right. If you have fish, probably won't, it'll be fine. But dogs and cats, anything that's going to walk around, you have to be very careful. A lot of people have that problem. Fall because of it. Electrical cords, they should not be running across the room. Phone lines, right? Right, electrical cords. Look at
Example,
this, right here.
right.
Good,
Here's
great
the
example
example.
here. This is dangerous, right? So,
You did it.
not me. I came in there, it was right there. Phone cords as well. You have to be very careful where the phone is and keep the cord out of the way. Coffee tables, magazine racks, stuff like that. Plant stands, right? They should be away from where you're walking. It should be to the side. Look at your night table, by your bed even. In the daytime, and this should be just as an exercise, you should walk through this, lie down on your bed, and go to the bathroom like you would do at night, okay? But do it in the daytime, and just look at the area that you're walking, and see, in my bedroom. So my wife will sometimes come in, put down, in our bedroom, she went shopping or whatever, and like a big Macy's bag filled with stuff, and she didn't have a chance to take the stuff out yet. And it's late at night, I'm getting ready for bed, and I said, you know what? I know that, and it's right sort of in the same path that I would use to go to the bathroom at night. So I know that if I don't move that, if she doesn't move it or I don't move it, that's going to be a problem for me, not for her because of, it's not in her way in the path, but it is in mine. So I make sure that that's out of the way. I always check, what's going on here before I get into bed. It's just a good habit to get into. Do it in the daytime when the lights are on, just to take a look. Do you have a clear path? Is there any obstacles in the way? Make sure at night that if you get up to go to the bathroom, and most of us do, make sure that, you have some type of a night light that's on, right? So that you have, it's clear. We talked about scatter rugs, loose rugs. They're a no-no, right? And if you have anything that moves on the floor, if you have those types of rugs, you can put they have these, you can buy it or you can make it yourself, double-sided tape. Put it so it at least won't move. However, you have to be careful that you don't catch your foot on it. And you can trip on them. Okay? We've had a lot of patients that they fall and it's because of that. Okay, anything that falls, liquids, grease, food on the floor, don't say I'll clean it up later, do it now, because, you know, you leave it and you don't realize, you forget it's there, and then you're in trouble. Somebody mentioned before, the bathtub, the shower, major problem, okay? Getting in and out. I would recommend for everybody to have, if you can, a shower chair, or it's a chair that goes in the shower or in the tub. You sit down on it, okay? You can get, it costs like $15, $20, one of these handheld shower things to shower yourself sitting, okay? You can stand also, but at least you have the option to sit in the tub or in the shower, where in the tub you don't have to get down on the, to take a bath. You can sit on a chair. It's much easier. It's much easier getting up and down. Also, this building I think probably has grab bars, right? Do you have bars in the shower, or no?
Yes.
Some of you yes, some of you no. I don't know.
Well, not everyone lives here.
Not everyone lives here. Okay. So, but it's a good idea to. Again, it's not expensive. It'll cost. It's for a grab bar. It's something like $15 to $20 to have it installed. You can't do it yourself. You need, a hardware guy or a super in a building can do it for you. But it has to be installed into the, not just the tiles. It has to go into the beams, so that someone has to know what they're doing when they do it. So otherwise it will pull out if it's just in the tile. Okay. Also, obviously, we all know non-slip mat in the bathtub or in the shower, so the surface is not slippery. Okay. We talked already about step 5 is to light up your living space. As you get older, you don't see as well in the dark or in dim light. Okay. Keep it lighter than usual, even. Okay. So assess that situation for yourself. So as the day, especially the sunset, like now it's like 7 o'clock. In another month, it's going to be really early, and then we turn the clocks, and then, at 5 o'clock at night, it's dark outside. So you have to make sure that your lighting in your apartment is sufficient enough so that you're seeing everything clearly. Okay. Okay. And the last step really is you have to assess for yourself, and maybe with your doctor, and maybe with a physical therapist, to check whether you really need to walk with an assistive device, a cane, a walker. There are a number of different types with wheels, without wheels. There are some, there's one with wheels. There are some, and you have, I see the skis on the back. That's very good.
I own my house.
Okay. Sometimes you see people with half tennis balls on the bottoms. That's good, actually. They work well. Some walkers have a seat, baskets on them, brakes, so that you can actually and have 4 wheels, and they're very maneuverable. You can, and they go over bumps, and they're good for outside on the street as well. They have, you can lock it. You're tired, you're walking outside, you can lock it and turn around and sit down. Okay? That's helpful. You need to see what are your needs, okay, and assess it, and don't wait too long. People are often in denial, or I've had patients. I once had a patient who was about 92, and she needed to use a walker, and she refused. Why? Because it would make her look old. She did not, right? She didn't want the neighbors to say that she's old. So she was 92 years old. So, you got to get rid of that vanity sometimes. You have to say, okay, what is the reality here? Do I need one? Will I be safer? Is my balance better? Can I walk better if I have this little thing with me? And if the answer is yes, by all means, obtain one for yourself or consult with your doctor. Sometimes they're, if you're under home care or from a hospital, they're paid for by Medicare usually, or insurance. Depends on the device, etc. So it's something to think about, though, okay? The bottom line is we need to prevent falls. Don't wait till it's too late, okay? Any questions? You've been a wonderful audience. Yes?
Would you recommend a hardwood floor to someone our age or wall-to-wall carpeting?
That's an interesting question. There are pluses and minuses for both, pros and cons for both. a hardwood floor in general would be better. It's a little safer. When you have carpeting, the carpet itself can become, you can sort of you can catch yourself if you don't lift, the other thing, as you get older, and also, unfortunately, some diseases, for example, Parkinson's is one, but there are many conditions that cause us to take less of a regular big step, and you end up shuffling a little bit or dragging your feet a little bit, and carpets are really terrible in that case. The problem with the hardwood floors is it's only a problem if you are going to wax it or mop it, and you're going to have wet spots, or the wax. You have to use there are floor waxes that have that are non-skid, right? So if you use that, you're okay. So the hardwood floor is generally better than the carpet. Right, but if you have throw rugs on the hardwood floor, then you've introduced another problem. That is dangerous. Correct. I would do it without the throw rugs.
And if you live in an apartment building, you have to have
carpeting,
carpeting second floor
right.
up.
You're right. You're right.
80%.
So if you need carpeting, the lower the pile, the better. Right? Yes.
Carpet's out here, how much time I'm walking I stop short with my sneakers.
Right. You get caught.
Be careful, you gotta
Right. By the way, just if you find yourself shuffling a little bit, something to mention to the doctor, because you could get a referral for physical therapy, for example. You need to relearn. You have to make it conscious how to take steps when you're landing on your heel. You have to think about it, landing on your heel with each step. So it then prevents you from doing that shuffle step. But it has to become a habit again. You have to learn that. But these are things that you can learn. And exercise. You can't get too much of it, right? Consult your doctor before you do it, but you gotta do it. It's key. Good.
What do you do if you have an older, like my mother, she has the beginning of dementia, okay, and Christmas time she fell, leaving my sister's house and fractured her foot. We keep trying to tell her to use her cane, but she's stubborn and doesn't want to use the cane. I'm like, Mom, but you keep falling. What do you do?
I don't know. That's a big problem. You need to maybe have someone with her who's a companion, so that when she does walk, I know these are very difficult.
Like my mother is 83 and my mother-in-law is going on 87, and it's like so hard to convince them that they need help.
Right.
And it's really like, okay, what do you do?
Right.
The trouble is,
Well, my mother, she doesn't have Medicare, but she never even qualified for she does not have Medicare. She just has her own private insurance.
Maybe you need a professional to say to her, you know what, you need a cane, and I'll teach you how to use it. The doctor maybe should recommend her to go to physical therapy for a bit to train her to walk with a cane, and maybe if she feels confident, like I can do this, and it's no big deal, get her a fancy cane. They have these, and they're not expensive either. You can get it in the pharmacy. They have all kinds of different colors, and nice handles. Maybe that'll make her feel better.
The one I gave her, I was using, but the one was normal.
Yes, maybe let her pick it out. Something that has pretty colors on it. All right, very good. Thank you so much for your attention. Have a great day.
Thank you very much, and Margie, thank you. This is, I think, Lawrence Home Care has given the Tuckahoe seniors the biggest plug of all. And Tuesdays and Thursdays from 10:30 to 11:30, we have exercise class led by a certified trainer, and we work on balance and muscle strength. So people who are out in the community come and join the Tuckahoe seniors 2 to 3 times a month. At noon we have Tai Chi. Some people take advantage of both. Some like the exercise and some like Tai Chi. So if you're interested, let us know. We're part of a fall prevention study run by the University of South Carolina. And we're just a very, very good exercise program, even though some people do fall once in a while. Thank you both
Thank you
very much.